I'm Maggie. I'm going to be your nurse today. Before we start, I'm just going to ask you a few questions. First, can I get your name and date of birth?
COPD, 6/27/1996.
Okay, perfect. COPD. And then, do you have any allergies that you know of?
None that I know of.
Specifically, do you know if you have any to iodine or latex?
Nope, I don't.
That's perfect. So looking in your chart here, I see that you need to get a catheter in. Do you know what a catheter is?
Nope.
So what a catheter is you've, I see that you've been just, in your chart that says you've been having trouble just going to the bathroom and that you're been feeling a lot of extra pain on the area in your bladder. So this will help you go to the bathroom and will relieve that pressure in there. So, and hopefully making you feel better. So for
Okay.
thing, just gonna start to roll the blankets down here and get you positioned for putting the catheter. And I'll try and keep you as comfortable as I can here. Move your legs here. I'll keep you covered as much as I can. So I'm gonna get my workstation up here. Okay, and so here what I do is I've already done the pericare. So I already washed you up, so now I'm gonna do this because I'm gonna go and get my sterile gloves on. I'm gonna make sure that it's not wet at all, that the surface is dry. It is. I'll put on my gloves here. Okay, so now I'm going to put the drape. Yeah, I'm going to do it, it's called airplane, so that I keep my gloves sterile. Make sure that I don't touch your legs at all. I'll go in here, and I'll leave it there. I'm not going to be using the fenestrated drape because it doesn't allow me to see the full area, so I'm not going to use that. Now I'll just put the lubricant on the catheter here. Allows for just some easier, for it to just go in a little easier. Attach the tube in here. Here now I'm going to move over to the sterile field here. I've already done the pericure here. And then I will clean this thoroughly. So I'm gonna open up here, and I can see the meatus here. I'm gonna take this swab and go farthest away and maybe from top down. Sorry, it's gonna be a little chilly here.
Make sure there's no twirls or kinks in the tubing.
And this side as well. Open the meatus. So I'm gonna insert the catheter here. It shouldn't hurt at all. So if you feel anything, just let me know. But you can just take some nice deep breaths here. I'm gonna insert it about 2 inches, and I see you're gonna do another inch there. And I'll hold it in place. I'll push up the balloon here. And you should not feel anything, but if you feel any pressure at all, just let me know, and then I can stop.
Good.
Stuff here. And then I'm going to pull back a little bit, and it is in there. Good. So then I'm going to take your braid here and make sure there's no kink, which I don't see at all. And then I'm going to attach this to the bed frame here, away from the rail so it doesn't get pinched or anything like that. And so that the urine's moving down, which I see. I'm going to clean up the rest of this here. And I would take off my gloves. And I would do pericare here. I'm going to clean you up again. And then I would wash my hands, and I would put on another pair of gloves. And I would do that just putting on the catheter. And making sure that as I attach this, that there's some room so that you can move around and it doesn't get stuck at all. There you go. So I'm going to move your things down here. Thank you so much. You did so good here. Got your space, but I'm glad that went in nicely. Thank you so much for being a trooper. Let me move the bed down here. It's more comfortable. Your call light is right here. If you need anything, just let us know. I'll be back in just a little bit to check on you. I'm just gonna put the catheter in. And making sure everything is cleaned up here and wagged out there.